Okay, namaste once again. Let's get started. Well, thank you so much for joining in today, your Sunday evening with us for a health talk. And I'm sure the next 1.5 hours will be worth your time. So this talk is organized by Hindu Center. And for those who are not aware, we are a non-profit organization. And Hindu Center works for the welfare of community through three main pillars: Jnana, which is the knowledge-based activities; Bhakti, the devotion-based events; and Seva, our service-based activities. So as part of our series of health talks, today's talk is on food and wellness, managing diabetes, acidity, and boosting immunity. And we are very happy and proud to welcome our guest speaker, Ms. Meenu Agarwal. She's a clinical dietitian and nutritionist based in Singapore. She has a master's degree in clinical dietetics and food science, and she has a vast experience working in government hospitals and also in the private sector. She runs this website called foodandwellness.com, and I just took a quick look, and she has some wonderful recipes. Do check it out. She advises clients globally on how to improve health, fight medical conditions with the right food, nutrition, and lifestyle choices. And obviously, she believes in food and nutrition, which will affect our health. So, as they say, you are what you eat. So, she has kindly agreed to enlighten us on how food is closely linked to wellness. So, over to Ms. Meenu Agarwal. She'll be sharing her presentation. And just a request, I'm sure you all have a lot of questions. So request to please park your questions till the end of the session. You can use the raise hand functionality on Zoom. You can type in your questions in the chat box, or you can just unmute yourself at the end of the session and ask your questions. So please park your questions till the end of the session. Thank you, Ms. Meenu. Over to you.
Thank you, Soundarya. Thank you, everybody, for joining in today's, and glad to see all of you here. As Soundarya has already said, I will be sharing a small PowerPoint presentation today, and we'll try to cover three topics as it is suggested: diabetes, acidity, and immunity. I would like to start with diabetes first, and gradually we will move on to the other topics. And also, as she has said, feel free to put up your questions, as many as you have, in the chat box. Later on after the session, you can raise your hand or unmute yourself and ask your questions. I will try my level best to answer your questions. Okay. So let's start with diabetes. First thing, we need to understand what is diabetes. Diabetes is a disease that occurs when your blood sugar becomes too high, which is more than normal. So blood glucose is your main source of energy. It comes from the food you eat. So whatever we eat throughout the day, that food is converted into glucose, and this glucose, the function of this glucose is to provide energy to your body to perform the various different functions of day-to-day's work. Now, insulin is a hormone which is generated by pancreas, and this helps glucose from the blood cells to be utilized by the body for their energy needs. Now, what happens when this insulin, either it is not generated in your body or it is not enough to convert that glucose, to transport that glucose to your cells, then that is the condition we call diabetes. Now, in absence or lack of enough insulin, what happens? The glucose, it is unable to reach to the cells, and it remains in your bloodstream only. This is the condition when you test your blood test, and your blood glucose level will show high. Why? Because this glucose, which is supposed to reach to your blood cells, body cells, which the glucose which we observe, we get from the food we eat, the function is this glucose should be transported inside the cell. Why? Because this will act as energy. This will help and enable the cell to utilize the energy to do all the bodily functions. But the moment if there is no insulin or not enough insulin, so not enough glucose molecules will be converted or transported to the cell. Thus, this will remain in the blood unutilized. This is a condition which we call diabetes. Now, there are various kinds of diabetes. First of all, I would like to focus who are the people who are more likely to get diabetes. First, people who are 45 years old, or more than that. Second, people who are having family history of diabetes. Or third, those who are overweight or obese, or those who are super sedentary, like their physical activity is almost nil, or certain ethnicity also adds on to this, like Asians or Indians or Americans, American Indians, they are very, very prone to having diabetes type 2. And health conditions like high blood pressure, also, low levels of good cholesterol or high levels of triglycerides also contribute towards type 2 diabetes. So these are the diabetic condition. Majorly, I'm talking about type 2 diabetes. I'll come back to the other different types of diabetes. And also type 2 diabetes, or who are the people who are more prone? Those who are having any history of heart disease or stroke, or those people who are having, like those females who are having a history of gestational diabetes. This is a diabetes condition during their pregnancy period. Or those who are suffering with PCOD or depression. They are the people who are more prone to have diabetes later in their lifespan. So let's understand how many different types of diabetes are. There are three most popular type of diabetes. Apart from that, there are two, three more variations, but major is this three types, which we will talk about today. So type 1 diabetes is the condition when your body does not make insulin at all, when your pancreas is unable to prepare to make insulin. It is usually found in young children or young adults. So out of the whole population of diabetes, 5 to 10% of diabetic population suffers from type 1 diabetes. And the second category is type 2, which is the major one. Here, why we call it type 2, this is here where your body is either not able to produce insulin, or otherwise, even there is production of insulin, that insulin is not utilized by your cells properly. Because of certain inactivity, your body has become irresponsive to the insulin. So this is what we call type 2 diabetes, and this is one of the most common type. This is the most common form of diabetes. 90 to 95% of people suffering with diabetes suffer from type 2 diabetes. And the third form, which is also very commonly seen, is gestational diabetes. This develops in some women during pregnancy. And those women who are having or have gone through gestational diabetes, they have high chances of having type 2 diabetes later in their lifespan, and also their children have high chances of getting type 2 diabetes. For them, it is very important to understand and to maintain a better glucose level and a healthy lifestyle, so that they can avoid type 2 diabetes later on their lifespan. Here, a small simple example diagram I have shared. Try to just understand this. I could not get a better, clearer picture, so I'm just sharing this. On the left side, there is type 1 diabetes. If you can see the blue hexagonal structure, these are the glucose molecule. And these triangles are the insulin hormone. And this is the cell wall. So these are the green ones are the receptors of insulin. Like you can see, the triangles will be received by this green structure. And once they receive the insulin, they will give signal to this GLUT4, the yellow and the red ones. And then they will open up, allowing the glucose molecule to come inside the cell. Now you can see these triangles, these are hazy dotted structure. If you compare to the right side, the triangles are quite bright purple pictures, which means insulin is more here on the right side, which is type 2 diabetes. In type 1 diabetes, insulin is very less. So fewer molecules of insulin you can see. And since it is less amount of insulin, so less receptors are receiving insulin, so less amount of signal to open up to accept glucose, and the result is more glucose remains in the bloodstream unutilized. Wherein if type 2 diabetes, if you see clearly, more purple triangles, very bright and prominent, which means your body, your pancreas is releasing enough insulin. And now what is happening? The insulin is received by these receptors, but because of your body's condition, because of your some health issues, some muscular irregularities, your body is not able to send these signals properly to the GLUT4 receptors. Now, because the signals are not transforming, these GLUT4s are not able to open up properly, and they are unable to receive the glucose molecule. Thus, Not enough glucose is transporting inside your cell, and majority of the glucose molecules are remain unutilized in the bloodstream. So this is the basic difference between type 1 and type 2. First is not enough insulin, so not enough glucose transportation. Second is enough insulin, but it is not active. Body is not receiving it properly. So not enough glucose has been transported, and thus blood sugar level is high, giving you diabetes. Similar thing is explained here very nicely in this picture. On top it is the type 1 and the bottom it is type 2. In type 1 you can see glycogen and protein breakdown causing ketosis. Muscle is unable to use glucose due to low insulin because insulin is less. Pancreas is creating insulin, but it is lesser in amount. See, these green molecules are the insulin, and bottom picture, the green molecule is enough, which means pancreas is creating enough, sufficient of insulin. But what is happening if you share compare this to here? Increased glucose due to low insulin, because less insulin, so less glucose amount is transferred into the muscle. More glucose is remain in the bloodstream in the red portion. And in type 2, your muscles are unable to use the glucose due to insulin resistance. So your glucose are not being transferred and your blood sugar glucose is remaining high. This could be because of obesity, could be because of inheritance factor or other factors leading to insulin resistance. Now, what is gestational diabetes? Gestational diabetes is a condition in which blood sugar level becomes high during pregnancy. It affects around up to 10% of women during pregnancy in US each year, every year. Yeah. As I have said, you need to be very careful with this, especially the females through gone through this gestational diabetes, and also the children, because they are also prone to having type 2 diabetes later in their lifetime. Now, this is a data just been shared. Fourth condition we call pre-diabetes. So pre-diabetes, what is it? It is just the borderline, we say it's a stage before diabetes. If you see the picture I have shared on the right side, white, when the blood sugar level is below 100 milligram per dl, we call it normal. When the blood sugar level is above 100 or 100 is called pre-diabetic. And when it is more than 126, we call it diabetic borderline, which is basically setting up of diabetes. So 126 or more than 126 is considered as diabetes. Below 126 till 100, it is pre-diabetics, and below 100 is a normal level. Now remember, pre-diabetics are at high chance to become diabetic. Weight loss and increased physical activity may prevent or delay diabetes and may also help you to return your blood sugar level to normal. Now, pre-diabetics are always at increased risk of other health conditions like heart disease or stroke, etc. So ensure that you don't ignore your health, try to reverse your health condition. The most important thing is we need to understand the attitude should not be it's okay kind. Like most of the time I see client come and they ask, ma'am, I am not diabetic, it's just a borderline, just a little bit of sugar is high, but that's okay. So many people in my family is having diabetes. This attitude is serious. Don't take it like this. Diabetes is not considered as a serious disease. That's the biggest problem. Whatever stage you are in, take it seriously. Because if we are not serious about it, we will not work towards improving and reversing diabetes. There is nothing called mild diabetes, borderline diabetes, little diabetes. Either you are having diabetes or pre-diabetic condition, both are serious. So you must take it on a serious note. Sometimes it happens that our healthcare providers, physicians, they said you are having little diabetes or borderline diabetes. You need to understand they are trying to explain with respect to the patient they are seeing day in and out who are having high levels of sugar. So with comparatively, yes, your is less, but that does not mean that you will take it for granted and don't take it seriously and don't work towards reversing your health. So remember, psychological issues and patient attitudes to the disease is very, very largely overlooked, but this need to be addressed immediately. Most of the time I have seen in my personal experience, patients and their family consider type 2 diabetes as less serious. Okay, that's okay. It's there in every household. But they should take it on a serious note. Yes, right from the day they got to know that they are having diabetes, because this is one of the major issue in diabetes education, is understanding that this is a serious disease in all ages and all stages of the disease. Don't they ignore it. So what are the symptoms? How will you understand you are having diabetes? So I have given a picture nicely. It says frequent feeling of thirsty is a sign of diabetes. High blood sugar on testing is a sign of diabetes. If you see some tingling sensation in your limbs, in your fingers or your toes, that can be a sign of setting up of diabetes. Unwanted sudden weight loss could be also attributed towards diabetes. Frequent urination, frequent hunger pang, or blurry vision, these are all signs and symptoms of having diabetes. So I'm just sharing a normal diet chart, level parameters of diabetes, which you can make a note if you need to. First of all, what are the tests need to be done for analyzing whether one is having diabetes or not? First is fasting plasma glucose, which we call it FPG. Now, fasting plasma glucose should be either 99 or below for normal people, between 100 to 125 for pre-diabetics, and more than 125, which is 126 or above, is called diabetes. Second test is HbA1c. Now, HbA1c should be below 5.7 for normal. From 5.7 to 6.4 is considered as pre-diabetic, and 6.4 onwards is considered as diabetes. And there are two more tests called RPG, random plasma glucose test, and oral glucose tolerance test is also done. So random plasma glucose, if the parameters should be 200 or above, then we considered it as diabetes. And for OGTT, your parameter should be 139 or below. Pre-diabetics 140 to 199, and if it is more than 199, you are considered as diabetic. So these are the tests we need to know. Let me just go through it. What are the complications of diabetes? Why we keep telling as a professional, as a healthcare professional, that try not to ignore. If diabetes is uncontrolled, if it is not managed properly, the further complications are listed here below. It can give rise to heart disease and stroke. It can give you hypoglycemia if your diet is not properly managed. Diabetic neuropathy is a very, very common condition. Kidney disease, foot problem, eye disease, gum disease and other dental problems, sexual and bladder problems, UTIs becomes very common with female, and depression and dementia are also to add on. Now, talking about hypoglycemia, I need to focus on this a little bit more. Remember, when someone is suffering from diabetes, they need to always keep a check on their blood glucose level. Sudden drop in blood glucose is really something we need to avoid, because that's a hypoglycemic condition. Ideally, if you see your blood sugar level has gone below 70, 70, please provide some food to yourself. Below 70 is not normal. If it goes below that, you are becoming hypoglycemic, and that can be fatal. Try to avoid that. After this, I would like to focus a little bit on this diabetic neuropathy. Now, diabetic neuropathy, because of diabetes and the uncontrolled diabetes, and because of the high sugar level, gradually what happens, our peripheries, the sensation in the nerves towards our feet and hands becomes low. And we don't feel any sensation of pain, burning, or pricking. Our feet become numb. So this is something dangerous. This can lead to diabetic foot, a condition wherein small wound can be fatal, life threatening, and amputation can be followed. So because there can be a small cut or wound happens, and since you are diabetic and your diabetic neuropathy is already on, wherein you don't feel the sensation of pain, it becomes very difficult for you to analyze at the initial stage that you got a wound or cut. So for those who are suffering with diabetes, ensure that you take your proper care for your foot health. Remember to wash your feet every day nicely before going to bedtime, and try to dry it by dabbing nicely and softly, and ensure the places between the fingers, the toes and the legs, you must dry dab, so that they are not left wet, because if they are wet, there can be fungal infection later on. And also try to provide a nice massage to your feet every night before going to bed. Yes, this massage will help improvement of blood circulation in your feet, so that your nerves will be fine and you can feel the sensation, which is very much needed. And also, diabetes is the leading cause of kidney failure, accounting for 45% of new cases. And remember, 10 to 40% of those with type 2 diabetes will eventually develop kidney failure. So ensure that we try to keep our blood sugar level well balanced. And in fact, the good news is that type 2 diabetes is reversible totally, which means gradually, if we follow a healthy lifestyle followed by a proper diet and exercise mechanism, we can gradually pull out ourselves from medicines. Yes, people are doing, and this is something doable and achievable. So, because if diabetes is uncontrolled, it can damage your kidney badly. Now, this is some picture I would like to share here. If you can see the left, there is one white molecule. These white are the sugar molecules, and this red cells, this is our blood cell. The middle picture is the normal sugar level. Some amount of sugar is there, which is the normal one. And the right is when our sugar is high in our blood. So hypoglycemia, where the sugar falls drastically. This is something we don't want. We want to maintain this normal level. Remember, sugar increasing hyperglycemia is dangerous, but that danger comes with some time span. But hypoglycemia can be immediately fatal. So try to avoid hypoglycemia by providing yourself timely food in a proper manner. And also, gum disease and dental problem can be big in terms of poor diabetic management, because if your gum health is not proper, you will start losing your teeth, and then you won't be able to eat properly, you cannot chew properly, so your nutrition level will be compromised, and thus gradually your health can deteriorate. So remember also one thing, the current trend in treatment of diabetes is focus on medicines, which could be expensive for you and which are not always something which we want. We can take 2 to 5 oral medications. If still not controlled, people go for insulin shots, but nobody is looking towards a root cause solution. What triggered type 2 diabetes? So if we can cure it from the root, what is the reason? Our uncontrolled lifestyle, our improper food habit, super sedentary attitude, these are all the basic causes of type 2 diabetes. If we can reverse this, if we can improve our lifestyle, food habit, definitely our diabetes can be reversed. So how to manage diabetes? There are 4 steps towards managing your health, including diabetes. The first thing is follow diabetic diet, which is very important. Diet is the basic part of management on every health issue. Treatment cannot be effective whether you are having insulin doses or medication unless and until you check your diet. What you are popping inside your mouth is very, very important with diabetes cure. So ensure, apart from that, your diet should be working towards checking on your weight. Yes, if you are overweight, please try to reduce weight. Ideally, your BMI should be 23 or less than 23. If you think your BMI is more than 23, try to lose weight. Provide good glycemic control with blood glucose level as close to as normal as possible. And also remember, with diabetes, usually lipid profile goes little abnormal. So try to correct the lipid abnormalities too, which is your cholesterol and triglyceride parameters. And provide dietary requirement like adequate amount of protein, wholesome carbohydrate, and enough of fruits and vegetables in a daily diet. Also remember, not only food which helps towards improving diabetes or any health condition. As I said, 4 factors are important. So one is food, the second comes physical activity, which is exercise. Now physical activity promotes weight reduction first place, and it also improves insulin sensitivity. Yes, type 2 diabetes, as I have said, insulin is produced, is generated by your pancreas, but it becomes insensitive. So when we start becoming active, we start living an active lifestyle, our insulin sensitivity is improved. Thus, the insulin which is produced by pancreas will be utilized by your cell and to transport the glucose inside the cell. that will help you to reduce your blood sugar levels gradually. So exercise is mandatory. Regular physical activity and exercise should be considered. At least 30 to 45 minutes of cardiovascular exercise on a daily basis is mandatory, and if possible try to do 2 to 3 days of strength training or resistance training in addition. People should, however, should be careful about the potential risk of hypoglycemia and how to avoid it. Suppose I would like to just discuss about this. Suppose you are sitting along with some people, and suddenly, in the normal aircon condition, everybody is comfortable and you are suddenly sweating profusely, or you are feeling very low or dizzy. This can be a sign of hypoglycemia. You will test your sugar later. First, pop in some glucose or some sugary food. This will help you to release some glucose or sugar in your bloodstream. No, don't worry if your sugar level goes little high after that. That is not a risk. But if your sugar level goes very down, that is fatal. So try to avoid hypoglycemia. I'm sharing a list of do's and don'ts again. Avoid sweets and sugar. Avoid fruit juices. Yes, this is a common question. People keep asking me, I'm having this juice, I'm having that juice. Is it good for diabetes? Remember, avoid juices, any fruit juice. Please avoid. Have whole fruits. Why? Because whole fruits comes along with fiber, which helps regulating this blood sugar spike in your blood. Otherwise, if you drink just juice, it will immediately give sugar spike, which is not desirable. Avoid having large meals. Rather, break down this meal into small meals. You can have small, frequent meals on regular intervals. And also I've seen people, most of the time client come that, ma'am, I just eat 2 times or 3 times a day, that's all. So that allows you keeping long gaps between each meal. So that is not very advisable. Try to avoid that long gaps between your meals. And last but not least is drink plenty of water. Yes, water helps clearing all the or flushing out toxins from your body. So ensure that you drink plenty of water. In fact, water is one of the most important food for any health condition, and especially diabetes. We need more and more of water. After this presentation, I would like to switch. Just a second, I'll share another one. After this diabetes, would like to focus a bit on acidity. Yeah. So what is acidity? Now, acidity is a condition which gives you a sensation of kind of heartburn. What happens actually? When our stomach generates more than needed acid. So what is actually, why stomach is generating acid? So in normal, whenever we eat food, when it goes to stomach generates some acid. This acid is HCl, hydrochloric acid, which works on the food to break down the food, which helps in digesting the food. The problem is when there is excess or additional acid secretion than what is needed to break down the food. Now, this extra acid will not get utilized, and it will form some gases which will start pushing your esophagus, your food pipe, on the upward side. And that is when you start feeling a sensation of burning in your chest. That is acidity. You can also start feeling a sensation of fullness or heaviness in your throat. That is also acidity. So acidity is a condition when more than normal acid is secreted in your stomach. Now, why? Why do we see this excess secretion of acidity? There are the causes. The causes is when we consume food which contains excess fat, you feel or you suffer with a condition called acidity. Excess consumption of caffeine, alcohol, and smoking can also give rise to acidity. Also, staying an empty stomach for long time also develops acidity. Pregnancy naturally develops some bit of acidity. Obesity is a condition when you are overweight or obese, then also your body suffers with acidity a lot. And also old age is a condition wherein we face acidity because our gut movement, our digestive system slows down gradually as we age. Now, consumption of too much of junk food and following an unhealthy dietary pattern also gives rise to acidity. So what are the symptoms? Sometimes people say, no ma'am, I don't have acidity, but they are suffering with all other signs and symptoms of acidity, which they don't understand could be a result of acidity only. So I would like to share with you, if you're having frequent headache, heartburn, mouth ulcers, indigestion, constipation, or not feeling hungry, like a poor appetite by eating little bit of food, very small amount of food, you just feel too full. That could also be because of acidity. Or you feel tired or fatigued very frequently or very easily. That could be also because of reason of acidity. Burning sensation in upper part of stomach, like higher, just below the chest, that could be also because of acidity. You may feel nauseatic. Your muscle cramps could be there. And a severe condition is called GERD, which is gastroesophageal acid reflux, can also be a result of prolonged acidic condition of your body. And sometimes it is also seen that certain respiratory problems also comes, which followed by frequent coughing, but there is no fever or there is no infection. And sometimes people fail to understand why this persistent coughing is there in your body. That could be also because of acidity. So let's talk about GERD here. GERD is a digestive disorder. So these are the conditions which can be actually avoided easily. I would like to suggest something. Most of the time it is seen that people eat food very fast. While eating, sometimes food is something it's very, very neglected these days. I mean, like meal times. In fact, we are so busy with our work, we work and we eat. Sometimes we are walking and we are eating together. So these are something we need to learn, that this is something we are abusing our body. We are not supposed to do this. We are so engrossed with planning our calendar whole day, but we don't put a proper timing for our meal in the calendar. If you think properly, think nicely or deeply, you will ensure that yes, some or other time you also do this. But this is not correct. We must ensure there is a fixed proper meal time should be placed in our calendar, and rest of the day's work should go around it, so that we can enjoy our meal with peace. Yes, we must give at least 15 to 20 minutes of time to chewing. Start chewing your food thoroughly, have small bites at a time. Chew thoroughly till the time you see zero solid mass is left further to chew. Then only you swallow. Usually we chew 2-3 times, and by the time next bite is in and the previous bite goes inside. This is totally not correct. Why? Because the salivary juices which are supposed to work on your food in mouth does not get enough time to work on the food properly, and the unchewed unbroken food is passed on to stomach. Now stomach generates acid to break down this food, and naturally more unbroken food means generation of more acid to break down this food, and this will create more acidity. Now coming to GARD, what happens? There is a food pipe. Below there is a thin muscular lining which allows food to go downward direction. But when continuously your body is generating acidity because of your acidic tendency, your gases are pushing the esophageal pipe, the food pipe, on the upward direction. What happens? The film is pushed upward and allowing the acid to go up inside the food pipe, and that is when you start feeling a soury fluid inside your mouth, which is what the acidic taste, which is GERD. This is called gastroesophageal acid reflux. Your reflux is coming up into your mouth, and this is harmful. Try to avoid this. Long run, it can give you ulceration in the food pipe, it can give you mouth ulcer or esophageal ulcer, which we can actually reverse totally by avoiding irregular practice, improper practice of chewing. Try to start focusing on how we chew properly and how much food do we eat and what sort of food we are eating. So as I said, headache, heartburn, constipation, nausea, tooth erosion. Yes, tooth erosion can also be a result of hyperacidity. When your acid reflux is common in your mouth, without you knowing, your tooth, your denture is always facing that acid gradually, and this acid is corroding your tooth enamel, and gradually your tooth will become poor. So we must avoid this. This acidity can also give rise to mouth ulceration, which can be really painful, and frequent persistent coughing can be there. Usually what happens when somebody is suffering with acidity, we pop in antacid. Try not doing it. Antacid is just a quick relief. They are subsiding the acid, but it is not a cure. Cure is there in your lifestyle. You were not born with acidity, remember. It is your lifestyle which has gradually developed acidity in you. So try to reverse your lifestyle. Try to focus on correct chewing, correct eating, avoid eating junk food, avoid deep fried food. Gradually, you will start seeing a difference in your health. You will also notice increase your water intake, which will help you preventing from acidity. Why? Because water flush out extra acid in your body. Now, I am sharing some food, common food, which are triggerers of acidity apart from fried and junk. Chickpeas, the legumes, the chickpeas or kidney beans, or raw food or uncooked vegetables could be triggers of acidity. If you think you are uncomfortable or feel gassy after eating kidney beans or chickpeas, start avoiding them. They are not soothing your gut. So please give some food which will heal your gut. Try to add more prebiotics and probiotic in your gut so that your gut health will improve. That will help you to improve your digestion. Garlic, ginger can also be triggerers. Some people also feel uneasy after carbonated drinks. Refined flour, yes, this is one of the biggest culprit. Sugar, and as I said, caffeine, tea or coffee. Try to avoid this so that your acidity will be better healed off. Try to eat healthy. Improve your chewing pattern, reduce alcohol and smoking, avoid tea or coffee if you are continuously suffering with acidity. Avoid sleeping immediately after your dinner. Try to maintain a gap of 2 to 2.5 hours between your dinner and your bedtime. And try not to lie down flat on your bed if you are having GERD, means you have acid reflux regularly. Then try to elevate your head little up so that acid will not go inside your throat. It will go downward. And do regular exercise, that always helps. And with this, I will end the acidity part. And I will share now the last segment of today's talk, immunity. So we all know that immunity is our first line of defense against all illnesses, and this is a very hot topic right now at the moment. I know most of you want to listen to it, but yeah, let's discuss what are the major pointers how we can improve our body's immunity. Now, our body is given by nature two sorts of immunity, which we call innate immunity and adaptive immunity. So innate immunity is the immunity which is given in our body, in our blood, via the white blood cells and certain protein element which fights with, these are the natural soldiers of our body, which fights against any disease or illnesses, which or any foreign invaders like the foreign enemies which attacks our body. These are natural mechanisms. These natural soldiers fight against these diseases. This is our innate immunity given by nature. There is the second line of defense, another kind of defense system which we call adaptive immunity. It is like the by the vaccines and all, like we introduce those viruses or bacteria in small amount inside our blood so that our body cells, our soldiers, can recognize the face of the enemy. And later on, that disease when triggers, when attacks you, your body cells know, yes, these are the enemy cells, fight against it. That is how they protect our body. So that's adaptive immunity. Today I'll be talking about innate immunity, our body's natural immunity. Now, before I start, I would like to say our body's natural immunity goes down when we are suffering with acidity. Yes, in hyperacidic environment, whatever good food you eat, your nutrients are not absorbed properly, and thus your immunity will start gradually going down. And so as in diabetes condition, if you are suffering with a health condition like diabetes, your immunity will be compromised. So try to improve your sugar levels, try to improve your glucose in the blood so that your body's immunity can be better improved. Also, if somebody is having digestive disorder, its gut health is compromised, or having IBS or regular constipation or loose stool or frequent indigestion, their immunity will also get compromised. Why? Because whatever, no matter how healthy you are eating, your nutrients are not absorbed by your body well. And also certain condition, like if somebody is suffering with extreme condition of stress, yes, stress also compromised your immunity. We talk about COVID-19, but COVID-19 has come much later. It is more about present scenario that just let me just give me a second. I will just share the full screen. Yeah, so COVID is just new, but overall we need to understand that better the immunity of our body, the better defense we can provide our body. and our better survival is for us. So what are the elements which are needed to improve our immunity? As said earlier, there are always four elements we need to understand to improve your body's health, whether it is immunity or your diabetic health or your acidic environment. Always for a body's wellness, four factors are important. First is the right food to eat and keep yourself well hydrated. Second element is exercise, regular exercise. Third is improve your sleep. Yes, sound sleep is very, very important. Try to get sound sleep, and no matter, I mean, like, there's no fixed hours of sleep. Some people sleep 7 to 8 hours and they feel fresh, but I have seen people sleeping for 5 to 6 hours and waking up absolutely charged up and fresh. So, and even I have seen people sleeping for 9, 10 hours and still feeling drowsy or sluggish. So it's not about the hours you sleep, it's more about the quality of sleep you get. And also try to minimize stress from your system. So let's talk about food first. What are the foods which helps to improve your immunity? First food list I have shared here. First element is protein. Yes, we need to improve the amount of protein in your diet. We all know proteins are the building block of our body. Yes, like we build a wall, we need the bricks. If the bricks are of not good quality, your wall is not going to be strong. Similarly, proteins are the building blocks. You need to provide good quality, adequate amount of protein to your body. So what are the good quality proteins? All animal source of protein are the first grade protein, like meat, chicken, fish, eggs, dairy, milk, yogurt, cheese are good quality protein. Apart from that, soya protein is also first grade protein, which is soya bean, soya milk, or tofu, tempeh, tahu. And apart from that, the vegetarian protein in the second line, away from soya, all the beans and legumes and pulses falls in the category of protein. And also nuts and seeds, nuts like almonds, walnuts, pistachios can contribute good amount of protein. But ensure that you don't do too much in nuts. Try to have 10 to 15 pieces of nuts only a day, and 1 to 2 teaspoon of seeds like pumpkin seeds, chia seeds, flax seeds, sesame seeds are good source of protein too. After protein, I would like to focus on zinc. Would like to go about zinc. Zinc is also a very important mineral. It helps in building up our immunity stronger. Not only that, it also helps in the normal growth and development of the body. Have you ever noticed a person suffering from diabetes, if they get some cut or wound, their wound healing takes more time as compared to a normal person not suffering with diabetes? Why? Because usually people suffering with diabetes have seen to have low zinc level. So try to have adequate amount of zinc in your daily diet. Zinc also helps in reducing the risk factor of heart disease, cancer, and diabetes too. So ensure that we are having food enriched with zinc. So simple and easily available food rich with zinc are meat, legumes, and beans, seeds like pumpkin seeds, sesame seeds, cashew nuts, almonds, milk, and cheese. Also grains like quinoa, wheat, rice, oats, and eggs are good amount, having good amount of zinc. But remember, the best bioavailable form of zinc is available in milk and cheese. But these other sources are contributing to a good amount of zinc too. After zinc, I would like to focus on selenium. Selenium is a very potent antioxidant. It lowers down the oxidative stress generated by the free radicals in our body. So it reduces the inflammatory condition of our body, and thus it enhances our immunity. The common sources of selenium is all the animal protein like fish, turkey, ham, beef, chicken. Very few sources of vegetarian sources of selenium is in our diet, like Brazil nut. Little bit is available in spinach. Brazil nut is an excellent source of vegetarian selenium source. 3 to 4 Brazil nuts in a day can actually meet the requirement of selenium for a day. And those who are suffering with thyroid disorder, any thyroid condition, and if you are vegetarian, ensure you are having your Brazil nuts daily. And if under any circumstance, if you think you are intolerant to Brazil nuts, try to have a multivitamin supplement containing selenium. Try not to supply selenium separately without your physician's advice. Selenium is a trace element. It is needed in very, very small amount. If it becomes excess, can be toxic too, so try avoiding that. And after that, I would again focus here on iron. Iron is a very, very important mineral. We all know it in the form of hemoglobin. It carries oxygen from the lungs to the different cells of the body and takes oxygen and from the cells to the lungs for purification. Now, rich sources of iron is all green leafy vegetable, and the richest source is the red meat. Apart from that, vegetarian sources are plenty, like all the dals, beans, pulses, dry fruits and or nuts. Dry fruits like apricots are rich source. Nuts like pistachio, almond, peanuts are also very excellent source of iron. Now remember one thing here, vegetarian sources of iron are many, but absorption from vegetarian sources goes low. For females especially, they need to maximize the absorption of iron, because females, their iron losses during periodic flow is very high. So women having in the periodic age from 10 to 55 of years of age should maximize their iron rich food. And if you're vegetarian, please follow certain pointers, that like one I'm saying before, when you are having your meals, like main meals where you're having your beans, pulses or vegetables from where you target your iron, try to add some fresh lime juice. Yes, lime juice is excellent source of vitamin C. This will help better absorption of iron from the beans and vegetables. So try to add that, and avoid having calcium source or dairy. Why? Because dairy is a rich source of calcium. Like usually we eat some sort of yogurt, curd or buttermilk along with our main meal. Try to avoid doing that. Rather, you can keep a gap of 30 to 45 minutes between your main meal and any dairy intake. So main meal wherein you are having your iron resource, you can have along with some vitamin C. And after 30 minutes of having your meal, you can have your yogurt or buttermilk, so that your body will get the calcium and probiotics from that, and also protein from the dairy. And it will not hinder or interfere with iron absorption too. So apart from this minerals, I would like to suggest on vitamins, like vitamin A, C, D are very important. Vitamin A and C you can get from different colorful fruits and vegetables. Fruits and vegetables like orange, red, yellow, purple are good sources of vitamin A. And all citrus fruits and vegetables are all citrus fruits are excellent source of vitamin C. So vegetables like carrot, sweet potato, bell peppers, fruits like mango, these are excellent source of vitamin A. Now remember, vitamin A, how does it help? It helps the inner lining, inner mucosal line of the body is taken care of by vitamin A. If your inner mucosal line is not healthy, if your vitamin A is not enough, not in good amount, then the digestive juices will not secrete properly, absorption of nutrients will not take properly. And not only this, vitamin A also contributes to our eye health, so it is very important. Also remember to ensure vitamin C, we all know this is how important it is. It is an excellent antioxidant, and any cough, cold, flu, we always look after towards vitamin C. So ensure we are having all the citrus fruits. Guava, yes, guava is an excellent source of vitamin C. One medium size of guava can suffice as 70 to 75% of a day's requirement of vitamin C. So try to add these different sources of fruits and vegetables in your daily diet. Try to have at least 5 servings of fruits and vegetables together in a daily diet. So one serving is like a size of a tennis ball. So 1 to 2 bowls of vegetables and 2 to 3 fruits in daily is easily doable. And I would like to focus one more thing here on vitamin D. Vitamin D actually direct relates with our immunity. Unfortunately, there's hardly any source of vitamin D in our diet. So exposing to early morning 2 hours sunlight can give you some amount of vitamin D, but that is sometimes seen not enough, because our body's melanin composition is not allowing enough of conversion to vitamin D. So I would suggest go for regular supplementation for vitamin D, so that your body should not go low on vitamin D, because D acts as a pre-hormone in your body. If it is low, first of all, your bone health will get compromised. Second, it can aid into heart health, in diabetes and obesity. And since it is a pre-hormone, its deficiency can lead to imbalance of other hormones too. So try not to go deficient. And these days, research has also shown direct impact on immunity of low vitamin D. After this, I would just like to focus on certain important spices and condiments easily, readily available in our kitchen. It's like first is garlic, cinnamon, nigella seeds, carom seeds, and turmeric powder. These are excellent spices and condiments. Now, garlic is so important, such a potent antioxidant. When garlic contains a compound called allicin. When we chew or crush garlic, this allicin gets converted into a sulfur-bearing compound called allicin. And this allicin is so strong, it can actually boost the fighting mechanism, fighting capacity of our white blood cells. So try to add more and more garlic in your daily diet in any form you like. And carom seeds are excellent source of digestive juices too. They are not only antibacterial, not only antifungal, they are excellent digestive seeds to have. So these days, usually in the home stay conditions, digestive system goes for a toss. So after every meal, you can try chewing carom seeds a tablespoon with a pinch of table salt. You will start feeling immediate relief. And we all know how important turmeric is. Turmeric has immunomodulating capacity. So try adding more and more turmeric in all your foods, curries, dals, soups, or drinks. But remember, turmeric works the best when we have turmeric in combination with a pinch of black pepper powder and few drops of some good fat, which could be organic ghee or organic or virgin organic coconut oil too. But in childhood, we have learned to have a warm cup of milk with a dash of black pepper and turmeric powder. The fat of the milk itself helps towards absorption of turmeric well. So no matter if you think you cannot digest milk, no worries. Whatever drink you go with, add turmeric, black pepper powder, and few drops of either coconut oil or organic ghee will help you to meet the requirement. So don't forget the importance of sleep and exercise. We'll like to just wrap up with some few pointers. Start your day with warm water and lime. Squeeze lime juice on cooked food you eat. This will help enhance iron absorption from your food. Try to add prebiotics like legumes and beans and probiotics like yogurt, curd, fermented food like idli, dosa, uttapam, dokla, tofu, tahu, or kimchi in your daily diet. Remember to have 5 servings of fruits and vegetables in your daily diet. Have lots and lots of warm fluids like green tea, fennel seed tea, clear soup, lime water. For non-vegetarians, adding clear chicken broth or bone broth in diet is really helpful these days. You can keep adding herbs and spices like ginger, garlic, turmeric, tulsi, oregano, thyme in your daily diet. Vitamin A, C, D, E, iron, zinc, selenium, omega-3 are excellent goods for boosting your overall body's immunity. Try to do deep breathing exercise and alternate breathing exercise daily. This will help improving your chest cavity. Your lungs will get open up more, and this will allow more oxygen to come in. And try to catch up on your sleep. Try to get a sound sleep of 7 to 8 hours. Why? Because when we sleep sound, our body's healing mechanism works. That helps improving our immunity too. So try not to go down on sleep. Try to catch up on sound sleep. And with this, I will end up the PowerPoint presentation here. But remember, I would like to say one thing. No matter how healthy you eat, always remember all healing work takes place in 4 mechanisms: food, exercise, sleep, and reduction in stress. I'm ready to take all your questions now.
Ms. Meenu, thank you so much for that wonderful presentation. 3 presentations wrapped in one. I mean, I totally enjoyed the slides, the illustrations. It really helped us anchor the concepts you were trying to say. Thank you so much. We'll remember diet, exercise, sleep, and reduction of stress. I took a note. So thank you so much. And even little tips like how we don't chew food, how we don't make time for meals. I think that's very true. Thanks for that. Very enlightening. Now we'll open the floor for questions. I have a couple of questions, but before that, please, a gentle reminder, you can raise your hand or unmute yourself to ask your questions. Do we have any questions you would like to unmute and ask Ms. Meenu directly?
I have no questions. As long as they understood well, I am fine. I just want them to self-realize that do they suffer from any of the symptoms which I have discussed today? Do they follow the principle of correct eating, correct chewing? Do they fix their time of sleep or time of meal? If not, they should start doing it.
Okay, let me start with the question I have from Mr. Murli on GERD, GERD. So he says he has chronic GERD and he's a vegetarian. So he has been careful, but when he eats outside, he does get the acidity. So suggest how to overcome this eating out.
Totally. First of all, you need to check what you are eating outside. Try to avoid deep fried food or try to avoid refined flour or very high sugary food because this gives more acidity in your body naturally. Second, no matter even if you eat outside or within your home, or it is a outside food or home cooked food, try to emphasize on how do you eat. Ensure that you are giving 15 to 20 minutes time to your meals, and this 15 to 20 minutes is not in discussion, it's rather more focusing on your chewing pattern. So ensure that you have small bites at a time and you chew them thoroughly each bite till the condition that when you see there is absolutely zero solid food is left in your mouth to chew further. Keep chewing and then only you swallow. And then you let the next bite go inside your mouth and keep chewing and eating till you feel 80-85% full, not 100% full, which means almost full, little bit space is left to be full. Leave it. Give that gap to your body and wait for 10 minutes. I'm sure you will not feel hungry. And ensure that you are drinking plenty of water. And if you are a person suffering from GERD, please ensure avoid long gaps, have small frequent meals, don't eat big meal at a go because that will create more pressure, and avoid sitting or lying down immediately after your meals. Try to walk or stroll after your meals. That will help you better digestion of your food. I hope
Thank,
it's clear.
yeah, thank you. There's a follow-up question. So, if you have acidity, can we take fruits like oranges and grapes, which are acidic?
Now, oranges and grapes are absolutely fine to have, but then, as I said, everybody, every human is unique. Every individual is different. Even if you're suffering with acidity, I have seen that level of acidity also varies from person to person. So you must observe your own body's health. If you think you eat orange and that's triggering your acidity, please avoid. But if you think you are not getting any acidic bout after having oranges, please continue. Sometimes what happens, we keep prolonged gap between this meal, and with that gapping, and then we consume a fruit which is citrus, and we think it is developing acidity. But it is not only because of the food, it may be because of this long gap which has actually triggered acid in your body. So try having a small gap between meals and then try the same fruit. If that still gives you acid, it's better to avoid. Otherwise, I don't see any reason of avoiding those fruits.
Sure, thank you. We have a question from Ms. Padmini. What's a healthy substitute for sugar?
No sugar is better, no sweetening agent is the best. That's the healthy substitute, Miss Padmini. Jokes apart. Yes, try to cut down your sugar gradually. Remember, sugar is the worst addiction, even worse than caffeine. It is easy to go off coffee or tea within few weeks, but it is very difficult to go out of sugar for months. So it needs a lot of discipline and mental power to say no to sugar. But trust me, gradually cutting down is always the better way. If you substitute sugar with jaggery or brown sugar or any other thing, those are also equally harmful. They are not good too. These are all some stuffs which will go inside your body similar manner. So it's better to say no to sugar. We don't need it. If you really need some sweetening agent, we can add natural dry fruits like date or apricot. We can chop small pieces and have few pieces at time. Those small pieces at time, that will kind of release some sweetening taste in your mouth to satisfy your sweet tooth. You can have few raisins, which are natural sweetening agent. Try not to have any sugar.
Sure, thanks. Okay, another question from Siva. Is it okay to consume probiotic drinks like Yako on a daily basis?
Actually, I will not promote Yakult. It is not good to have Yakult. Yakult is a very high sugary drink. We think it is a probiotic, but it's actually harming your body. You don't need Yakult at all. Greek yogurts are much better probiotic drink to have. You can have plain Greek yogurt or the homemade yogurts are good. You can have kefir, non-flavored kefir. Those are better probiotic. You can kombucha. These are good probiotic drink. In fact, India has a lot of old techniques. Even China, I know there are a lot of old techniques of having homemade probiotic drink. Like we make gajar kanji, which is carrot, fermented carrot or fermented beetroot. This fermentation gives excellent probiotic in the drink. You can keep drinking those. Those are available in market too. Kimchi is excellent fermented food to improve your probiotic health. fermented food like dosa, idli, this helps improving your gut health. But the problem is we eat them in excess. We make dosa with a lot of oil. Try to reduce that oil and then eat it. It is excellent for your gut health. We really don't need Yakult. It's loaded with sugar. Try to read the label before you buy any drink or so-called probiotics. With the billions of healthy bacteria, it is also written amount of high sugar content in it. So please avoid it.
Totally. I'll just pause and I will switch to the YouTube because you're also going live on YouTube. We have a couple of questions there. Mr. Varprasad would like to ask regarding frequent burping. What causes this and is it a matter of concern?
Yes, absolutely. It's a matter of concern. This frequent burping is also a sign of indigestion and acidity only. So try to again follow the principles, the rules which I have suggested for acidity. Have small, frequent meals. Try chewing each bite slowly and thoroughly. And very important to understand why I keep saying every time that 15 to 20 minutes to your meal and 100% focus and attention should be towards meal. Why? Because our brain is a very small organ. And if it is already preoccupied at somewhere else in some other activity, it is very difficult to get the signals from the hormone on the right time that you are full. So try not to get yourself defocused. Focus and attention should be on your meal so that you learn to eat properly. And the food what you are eating, that also assimilates in your body well. Chewing slowly is very, very important. Try to avoid food like raw foods could be a very well triggerers in towards your indigestion. Avoid eating raw food if you are acidic or you are having indigestion or you are having burping. Try to eat fresh cooked food. That will help better digestion.
Sure. We also have a question from Susain. He would like to check if taking apple cider vinegar is good, if it's better to take it on an empty stomach.
See, having ACV or this apple cider vinegar, sometimes it helps reducing acidic condition, but not with many. I have seen various results with various people. So always, as I keep saying, like every person is unique. Keep observing the impact on your own body. If that food is suiting you, continue with it. If you think after having that food, I feel uncomfortable, please stop. No food is foolproof for each and every human. Even the two sisters of same biological parents can show extremely different signs and symptoms. So how can different people be same? And ACV again, any cider should not be had for very long period of time. This can actually deteriorate your bone health in long run. So these can be temporary reliefs. You can try for some period of time and then you should switch off.
Sure. Mr. Alok would like to thank you for the informative presentation, and he wants some tips to manage diabetes, given that we have a sedentary lifestyle and long working hours.
First of all, thank you so much for liking the presentation. The second is tips never works. And the third thing is you know that your lifestyle is sedentary. Work pressure will always be there, but ensure, trust me, sitting prolonged hours will never help you. You must need to prioritize your health because health is our wealth. If there will be no health, how will you continue working? Till now you are not able to see the complications which are forthcoming. They're lying there if your diabetes is not controlled. So please provide importance to your health. Try avoid sitting after more than an hour in a one place. After every hour, try to move on, get up from your chair, move, go, at least capture 200 to 50 steps. Try to do regular exercise, set timing for your meal, set time for your sleep. This is important. You cannot avoid this and just imagine that my sugar levels will go control. That never happens. These are equally important. We are talking about root cause cure. Root cause cure will be following all the principles. I just cannot eat good food and think that my diabetes will get controlled. This doesn't work like this. We need to understand it's our whole lifestyle which work towards improving. If I am not sleeping on time, if my stress levels are too high, I'm not working towards managing my stress level, my hormonal disbalance will be there. My hormonal imbalance will be created. Insulin is a hormone. If hormone imbalance is there, how will it work properly? If you are too much stressed, your corticosteroid hormones will go high. This will create another further imbalance in your system. This will further add on to your existing complications. So try to live a healthy lifestyle. Try to reverse gradually. At least you try to control whatever are controllable.
Sure. Miss Arna Singh has raised her hand. Would you unmute yourself, Miss Arna?
Yeah, I would like to know, is stevia safe?
See,
Taking
Ms.
stevia?
Aruna, stevia, there is no long-term research has come till now for stevia. Whatever research is available so far is about short-term, short usage, small usage of stevia is available. Till that, it's fine as long as you don't want to become the guinea pig. You can try a few times, sometimes, adding in your tea or coffee, but I would suggest gradually try to pull yourself out of sugar. Trust me, it is just a matter of discipline. Even I have seen this with me mostly. Whenever I travel often to India, especially to Calcutta, because I do consult from there almost every month prior to COVID. And whenever I go back home, people are like, I belong to Marwari family, and they're very, very prone. Calcutta Marwaris are very prone to have 4 or 5 cups of coffee or tea every day, especially tea. And every now and then tea has been made. And I cannot ask in my in-laws' house every time that don't add sugar. And saying no becomes not acceptable every time. So having small portion of those tea let me get used to of that sugar craving. And then once I come back to Singapore, I say, what is happening to me? Why am I want this sugar? I don't need it. And I say no to myself. And it just takes 1 week time for me to say no. And I just completely go off to sugar. This is your willpower. Just say no. Gradually, I'm sure you will pull off your sugar from your life. It is not needed at all.
Oh, thank you.
Okay, we have a question from Mr. Sairam. Is it okay to drink turmeric with warm water first thing in the morning?
You can, but as I said, turmeric works best when you add little bit of black pepper powder and a few drops of some fat, which could be either ghee or virgin coconut oil. Then yes, it will absorb better.
Thanks. And we have two questions on YouTube related to sleep quality, how to improve our sleep quality.
First thing is try to avoid any digital gadget exposure at least an hour and a half before your bedtime. Because once you move from your gadget and if you immediately go down to sleep, we don't realize our subconscious brain keeps us awake for further 2 to 3 hours. So first say no to any mobile, any laptop, TV, or any light emitting object. Then second, if you think you are still not sleepy, remember sleep is a quotient of mental fatigue and physical fatigue. If either of the one is missing, you will not get good sleep. So ensure that you are doing exercise regularly so that physical fatigue is also there. Suppose after that also you don't feel sleepy or you are suffering with some insomnia condition, try to ensure that before bedtime you dip and wash your feet in warm water or soak your feet in warm water. That will help calming and relaxing your brain muscles. That will also help inducing your sleep hormone. You can listen to light soothing music. Yes, light music helps soothing and relaxing your muscles, calming down your muscles. Objective is we need to calm down our muscles so that we can sleep properly. That helps inducing sleep. Some people feels good when they read book. Yes, reading paper magazine, not printed magazine, not the digital one, helps improving your sleep. Because if you notice, when we ask children to read book, if they are not interested, within 5-10 minutes they will feel sleepy, they'll fall asleep. Why? Because reading this print media always induce sleep hormones. So why not to utilize it for our benefit? Why not to use it for our sleep improvement? Try using these tips, I'm sure you'll get benefited. And also you can try doing deep breathing and alternate breathing exercise before going to bed. This will help improving oxygen intake and that also helps you getting good sleep.
Sure, thank you. We have a question on vitamin D supplements, if there are any adverse side effects.
No side effect. As
Okay.
long as you are having in moderation, mean the calculated amount, excess of vitamin D can give you toxicity. So it has to be advised by your physician, a proper regular doses by checking your blood levels of vitamin D. Don't take just pop in randomly.
Okay, sure. Ms. Hamza would like to ask about the benefits of pomegranate. I heard it is very good for heart. Is it true?
No one fruit can help your heart, dear. But yes, pomegranate is also a nice fruit to have, rich with antioxidants. It is a dark purplish reddish color fruit. And as I have suggested, a lot of vitamins are there and minerals too. Of course, it is heart healthy. But Don't think that if I keep on eating only pomegranate, it is going to give me a good heart benefit. That is not correct. Try to ensure you are having at least 3 to 4 different colorful fruits and vegetables in your daily diet. Why? Because every different color is associated with some different group of minerals and different group of vitamins and different set of antioxidants, and more the merrier. Our body needs all different types of minerals, vitamins and antioxidants. So try not to stick to only one particular food group. Try to have variety of them to get the benefit of all different types of fruits and vegetables.
Sure. And Mr. Nara has a question. I have lots of wind all the time. How can I solve this?
As I said, I have discussed repeatedly today's session. This is also a reason of acidic environment in your body. Focus how you are chewing, focus how much meal timing you are maintaining, and what sort of food. If you associate some particular food, like usually beans and legumes sometimes is seen to be hard to digest, people feel gassy after having them. If you think these are the culprit for you, please start avoiding them. And also raw vegetables sometimes become very gassy. So if you think you are eating raw vegetables, try to avoid them and see if that helps. We need to check what exactly you are eating, so as to analyze that this is working good and that is not, and based on that we can again reintroduce some food which is easily digestible by him. But of course you need to ensure that after your meal, please don't lie down, please don't sit, keep walking or strolling, and try to ensure you are drinking plenty of water. That will definitely help you.
Okay. And what is your advice about daily dose of omega-3 capsules?
Those who are regular fish eaters, they may not need omega-3 supplement, but those who are vegetarians, it is a good idea to have omega-3 capsules. If it is 1000 mg, you can have 2 to 3 capsules in a day. These are needed. These are really good for your health. You can have it. Yes. And yes, these are good for your heart health too.
Okay, we have a follow-up question from Murli on GERD. So he's saying that in spite of keeping raised pillows every night, acid goes up and irritates my throat. How can I overcome this? And again, taking probiotics tablet a day, will it help reduce this?
Yeah, probiotic help reducing this, but you need to make sure what time of the day are you having your probiotics. Probiotics are supposed to be best have immediately after your lunch, because that is the time when your acid is at the minimum and probiotics can work best in your body. Second, don't just think that eating this medicine or that supplement is going to help you for GERD. Try to check if you are overweight. Please try to lose weight, because losing weight automatically helps resolving complications of GERD. Second, as I have discussed so many ways of eating correctly, please try to focus on it. It's a slow process because GERD has not taken place in a day or two. It has taken years time for you to develop from a normal acidity to GERD condition. Give your body some time to recover from it, but in a healthy manner. Just don't think and imagine some magic will happen. Nothing works like this. GERD is simply your lifestyle disorder. So try to work towards reversing it gradually. If you think you are on the overweight side, don't even think, just check your BMI and see which category you belong to. Your BMI should be 23 or less than that. If you think it is more than that, please try to lose weight. If you think you need advice from a professional, don't hesitate to seek help from a dietitian or nutritionist, so that your diet can be well planned and managed and you can get a proper benefit by that diet and see a difference in your health.
Sure, thank you. And this is regarding one of your slides on immunity boosting food. Would you like to repeat what are the other powders that can be taken with turmeric?
So there is an excellent immunity boost powder we can make by mixing turmeric with certain other ingredients, like you can add carom seed powder, nigella seeds powder, cinnamon powder. Now this cinnamon powder is not the local cinnamon. It should be the Ceylon cinnamon, which we call rolled cinnamon, which is very effective. Add a pinch of black pepper powder and mix this, and add Manuka honey UNF 10 plus. Remember, Manuka honey UNF 10 plus, half teaspoon. And this will become a paste like consistency. If you don't like it, if you think it's very, very strong, you can add few dash of lime juice to it, and you can have it empty stomach daily to enjoy the benefit of this powder. You can start seeing a difference between 10 to 15 days. It is very effective in cold cough condition, so it is helpful.
Thank you. And there are a lot of people who are thankful for the presentation. They are appreciating the informative talk. And yeah, you should take a look at the chat later. We have a raised hand from Mr. Raj. Raj, over to you.
There are some questions from YouTube channel also. Can you look into that? Mr. Sada is asking some question.
Sure, will do. Okay, so Sada has a question on Hajmola relieving acidity and feeling of fullness, but isn't Hajmola itself acid causing?
See, sometimes we pop in all these hajmolas or these antacids to get immediate relief, or we pop in or drink some sodas to get instant relief. Remember, these are not the root cause cure. These are just subsiding of the immediate impact. These, as you well said, Saundarya, that Hajmola itself is an acid triggering agent. It may subside it for some bit of time, but this will trigger acidity more and more in long run. So try to reverse the root cause, the lifestyle which is developing this acidity to you in day to day. People often find quick fix solution. They run away from this hardship that they have to work hard towards improving their condition. They just look after for some quick fixes. Pop in medicine, oh, I got relieved, I am fine. But is this a solution? No, you are actually damaging your health internally more and more by popping all these antacids or these quick hajmolas or drinking those sodas. Don't do that. Try to gradually improve your overall food habit, your lifestyle. We have become so sedentary. People often tell me that I do this 30 minutes or 45 minutes of regular exercise. Yet why I see all these things. But they forget that after that 35 or 45 minutes in the day, the remaining hours, they almost keep sitting. They are not moving. So how will that 35 minutes or 40 minutes be effective in their lifestyle? We have to be more active, moving. Keep moving after every hours of sitting. That will help. That will add on to some activity level in your life. That is missing. We need it.
Sure, thanks for the reminder. We have a comment from Mr. Krishan. He says, we were told that turmeric with warm milk before sleep is good for health. And you mentioned that, add fat. So how does this? So the milk is the fat content, is it?
Yeah, milk has its own fat that adds towards absorption of turmeric. It's always a good idea to add a dash of black pepper powder along with that milk. Milk has also have its own ingredients which is called tryptophan. It's excellent amino acid which helps improving your sleep. So those who are not lactose intolerant, those who are fine with milk digestion, they can always have this warm cup of milk added with turmeric, a dash of black pepper before their bedtime. But try to maintain at least an hour and a half gap between milk and the bedtime.
Oh, thank you. And this is a very interesting question. So we, from Jay Kumar, he says that coconut oil is beneficial, but how about scraped coconut in the form of chutney, sambal, or coconut milk? Are they healthy? Because there's a lot of controversy around scraped coconut and coconut milk. And he's asking this question because his dad is diabetic and he eats a lot of coconut every day.
See, coconut overall is a source of saturated fatty acid. Having too much of coconut every day will increase your triglycerides level, which is not healthy. Having food in moderation is the key. Try not to overdo. If anything is good, does not mean you will overload your body with that stuff. Excess consumption of any one particular food is also not recommended. Have food in moderation to enjoy the benefit of the food. So having day in and out, all the gravies, all the food added with coconut is not advisable. Please have it in moderation. And also remember, whatever amount of fatty acid we are having, our body should be able to break down it. If we are unable to, because these days we are not that physically active. Old days, people used to have these amount of fatty acids added in their food and they used to digest it well because every work was done manually. Manual labor was high. Now we hardly move to get a glass of water and we keep on feeding ourselves with these traditional dishes, then naturally a calorie imbalance is going to set in and our body will suffer from excess deposition of this unhealthy fat. Then that excess fat which is not broken by body becomes unhealthy and deposited in terms of triglycerides, which we don't want. So advice is try to have it in moderation, not overload of it.
Sure. And we have a question from Dr. Prasad. How can we identify possible food allergies?
Possible food allergies, it is a little tricky, Prashant. First of all, when you start seeing some food allergies because of triggers and you are unable to identify, there are two ways. One is a test done for certain food, which can tell you directly whether your body is allergic to it or not. But yet that is not enough, because sometimes those foods may not be listed in that group. And these allergy tests are also not permanent. Some time of your lifespan you may be allergic to some particular food, which may get resolved over a period of time, and you may also get allergic to some new food groups. So ideally what we suggest as a dietitian, we start first removing from your diet the common allergy prone food, and start seeing that whether you feel better or not. And then gradually after that, we start reintroducing those food one by one to your diet. And then we observe whether you are feeling better or you are getting the allergic bouts again. And that helps us to kind of figure out that these food are suitable and these are not. And based on that, diet is adjusted. So if you think you are going through allergic bouts and you doubt that it is food allergy, it is better advisable to meet some dietitian or nutritionist to get this sorted out for you easily.
We have two questions related to oil. One is, which is the best oil for cooking? And is cold press oil really much better than the normal refined oil?
Okay, the first part is which is the better oil for cooking. I'll come to this first. Depending on what sort of cooking, what is the process of cooking you are using, oil is suggested accordingly. If your cooking is on high heat for a long time, remember you need to choose oil which has high smoke point, which will not break down easily. Because if I choose a low smoke point oil, it will become rancid, which becomes unhealthy for you to consume. So high smoke point oil could be mustard oil, could be coconut oil, could be groundnut oil, could be rice bran oil. Now, as I said, coconut oil, just don't pile on to have cooking all your food in coconut oil, because coconut oil is a high source of saturated fatty acid that is not recommended for cooking for every dish. You can cook some few dishes with coconut oil. Try to mix and match between 2 to 3 different oils. So for high heat cooking or deep frying or for cooking for prolonged time, you can use rice bran oil, groundnut oil, mustard oil, or coconut oil. Or even ghee can be used, but small portion only. And for low cooking, low heat cooking, for short term quick drizzling or sauteing or soup addition, you can use oil which has low smoke point oil, like monounsaturated fatty acids like olive oil or sesame seed oil or avocado oil. These are good for low heat cooking. Nowadays there is some bit of confusion. There are oils like they say it is olive oil good for high heat cooking, this is avocado oil good for high heat cooking. Now you need to understand what is the goodness of olive or what is the goodness of avocado. They are meant for their monounsaturated, their unsaturated fatty acids. If their basic property has been changed, which means the oil has been processed highly to get the property of high smoke point, which means there is no more goodness of this olive or avocado is left in the oil, then why do you use this oil for? We should not be using this oil. We should rather be switching to some high smoke point oil. And we can continue using avocado or olive oil, which are the virgin ones, the extra virgin ones, which are naturally meant for low heat or quick sauteing or drizzling only. I hope I am clear in saying choose your oil depending on what sort of cooking method you are opting. Usually Indian cooking or Indian type of cooking needs high heat, prolonged time. So utilize high smoke point oil. For soups or salad drizzling, try to use olive oil or sesame oil or fresh avocado virgin ones.
Okay, and how about the cold pressed oil? Is it really better?
Second part was whether refined oil or the cold compressed. Yes, cold compressed oil are always better than the processed refined oil, because during the process of refining it, the oil has to go through a lot of chemical processing, wherein in cold compressed it is directly compressed from the seeds. So cold compressed oil is always better than having the refined oil. Yes.
Thank you. That clarifies. So Mr. Sada has a question. Are peanuts as effective as the other nuts mentioned, which are expensive, like Brazil nut?
See, peanut is actually not a nut. We call it peanut, but it falls in a category of legumes. So peanut is not a real nut, but peanut is also a very high source of fatty acids, like triglycerides can go high if you consume peanut too much. So other nuts like almonds, pistachio, they are expensive, but their benefits are also high. I'm not saying don't eat peanut. I'm not saying eat only almonds or pistachio. You can have all these nuts, whether it is peanut or almond or pistachio, only in moderation. These are not advisable in large amounts. So choose your nuts. You can enjoy them, but not more than 10 to 15 nuts a day.
Okay, so just like the oil debate, we have the low-fat, high-fat milk, full cream milk. So the drink you mentioned, milk, turmeric, and black pepper, should we use low-fat or full cream, and any difference?
Ideally, low fat milk, I would suggest, because obesity is a very big problem these days. People don't even identify themselves being overweight, although they become on the higher side of the BMI. So I would suggest low fat milk is better.
Okay, thank you. And Mr. Muli would like to ask a question again on about how every night the acid goes up and irritates his throat, but when he wakes up in the morning, he's fine. So how can he overcome the acid irritating his throat every night?
Mr. Murli, I have repeatedly answered the same questions. Try to avoid having heavy meal before your bedtime. Have light meals. Try to focus on chewing. Try to drink more water. And even after having the meal, try to stroll, not to sit down or lie down. Try to go for a light strolling or walk, which will help better digestion and better utilization of the extra acid which is generating in your body. This will help subsiding your reflux while the bedtime.
Thank you. And a question on intermittent fasting. People who have thyroid disorder or diabetes, can they do intermittent fasting?
Now, intermittent fasting, we need to understand it's a process of lifestyle. It's not a diet which you will adapt for some day and then leave it. It is something, a lifestyle change. If you are diabetic or thyroid condition, you have to be very, very careful and watchful, and you should be doing under professional guidance. Otherwise, it is not advisable because it can impact on your glycemic condition. If you are going through you are having diabetes, you can go for hypoglycemia, which can be fatal for your condition. So you have to be very careful and watchful while you are doing intermittent fasting with any disease condition.
Thank you. So that's all we have questions now. So before we close, any other questions you would like to raise hand and ask over the Zoom session? Okay, if not, once again, Ms. Meenu, thank you so much for clearly answering our questions, for patiently taking the questions from all of us. It was very informative. And like I said, you've given us very useful tips that we can immediately start adopting. So I have taken on a lot of those things, like from chewing to putting some time aside for eating. So I'm sure all of us, we've learned a lot of things from this session. So thank you so much for your time. There are a lot of compliments in the chat. People want more such sessions in the future. Thank you very much. Sorry, yes, Mr. Raj, would you like to ask some question?
No, actually, I asked Dr. Prasad to say a vote of thanks, but he's on YouTube. So he asked me to. So thank you so much, Meenuji. It's a really wonderful session. I personally also, as Sondra was saying, I also learn a lot of things, a lot of new things. So once again, thank you so much on behalf of Hindu Center. Thanks.
Thank you so much, Raji. Thank you, Saundarya. Thank you for giving me this opportunity. Thoroughly loved the session. I hope there will people who have attended the session will be benefited, and I'm open for any such talks later in the future too. Thank you so much. Take care and stay safe. I'll leave it now.
Thank you so much. So just a quick note before we close off. So like I had mentioned, this is organized by Hindu Center, and we are a non-profit organization, and we are also constantly doing activities. So if you would like to know more about our upcoming activities, please join the WhatsApp group. So it's a broadcast list. It's not a group. So you will get to know about the upcoming sessions and talks. And you can also, if you would like to support our cause, you can also do an online donation. The link is flashed. You can use the QR code to access the page. And I'll also ping the website address, the food and wellness website by Ms. Meenu, where there are very interesting healthy recipes. I'll also ping the Hindu Center website address on the chat. So feel free to get in touch with us. And I can see that you're all interested in the talk. Hopefully we will meet you with another interesting food talk. So before we close, it's the tradition to do our closing prayers. And this is a very fitting prayer because we have spoken about wellness. And this prayer talks about Sarve santu niramayaha. Everyone should be free of illness. So in this COVID time, let's all pray that, we lead a better and healthy lifestyle. So let's do the closing prayers. Thank you very much. So we'll start with an Om and recite the prayer. Om. Sarvesham swastirbhavatu. Sarvesham shantirbhavatu. Sarvesham purnam bhavatu. Sarvesham mangalam bhavatu. Sarve bhavantu sukhinah. Sarve santu niramayaha. Sarve bhadrani pashyantu. Ma kaschid dukkha bhag bhavet. Om Shanti Shanti Shanti. Namaste. Thank you very much. Good night.
Good night. Bye-bye.